What is bladder cancer? Bladder cancer is a tumor that affects the bladder, and it involves a random, abnormal, irregular growth of the cells that make up the bladder, which is an important organ of the urinary system in both sexes. The bladder is a hollow and flexible bag. Urine is stored in it, and the tumor usually begins by infecting the cells lining the bladder wall, called transitional cells, and then gradually moves to the rest of the cells forming the bladder and may move to neighboring cells or other organs, including bones or lungs. There are many types of bladder cancer, and one of the most common types of bladder cancer is urothelial carcinoma, also known as transitional cell carcinoma, is one of the most common types of bladder cancer, appearing in endogenous cells, usually associated with the severity of cigarette smoking. Squamous cell carcinoma, which may be accompanied by inflammation or chronic irritation in the bladder, as a result of prolonged infections such as schistosomiasis or long-term stones in the bladder. Adenocarcinoma, which is a rare type of bladder cancer, begins adenocarcinoma in the cells forming the glands that secrete mucus in the bladder. The stage of bladder cancer is determined by the degree of tumor penetration of the bladder wall. Papillary is confined to the epithelium and does not penetrate the special lamina propria. Carcinoma in situ is a flat tumor that filters through the mucous membrane and is found in the underneath the healthy mucosa layer, so it can often not be detected and completely removed. A tumor penetrates the special plate, but does not penetrate the bladder muscle. A tumor that penetrates the inner half of detrusors muscles. A tumor that penetrates the outer half of detrusors muscles. A tumor penetrates a fatty layer around the blood vessels. A tumor penetrates the pelvic organs or the pelvic wall. There is also a microscopic classification of degrees of differentiation starting from 1 degree down to 3 grade high. The combination of these 2 grades enables the prediction of clinical disease. The most common clinical symptoms of bladder cancer are: see blood bleeding from the urinary tract. Hidden bleeding is detected only through laboratory examination of urine. Pain in the waist, due to obstruction of the urethra area due to swelling of the bladder. Frequency, urgency, and urination pain due to swelling of the bladder wall. Tumor shrouded in bladder neck and urethra. Risk factors for bladder cancer include sex, age, smoking, exposure to carcinogens, exposure to antitumor drugs, arsenic exposure, chronic inflammation due to bladder pebbles or due to the schistosomiasis parasite. Complications of bladder cancer. Complications include blood poverty, swelling of the ureter, the urethra narrows, incontinence, erectile dysfunction in men, women's sexual impairment. Diagnosis of bladder cancer is done by CT scan, endoscopy, or ultrasound. The necessary tests are computational tomography of the abdomen and pelvis, scanning of the rib cage, scanning of bones, blood tests of liver performance, or examination of alkaline phosphatase. If the tumor does not penetrate the muscle and is completely removed, and the patient does not face the risk factors for tumor return, the patient is sent to complete the medical follow-up, but if there are risk factors for tumor return, the patient should be suggested to perform a supplementary treatment by chemotherapy or immunotherapy for the bladder, as well as weekly protocols for 6-8 weeks to ensure that the tumor is not returned, as there are protocols for continuous treatment. Other treatments have been added in recent years, such as gemcitabine or synergistic technique, Synergos technologies, that integrates chemical treatment and heating. In the case of a diagnosis of a disease that penetrates the bladder muscle, a radical bladder removal is required. In this surgery, the prostate and sperm vesicles are removed in the man. In the woman, The hysterectomy, horns, ovaries, and the front part of the vagina are performed, while projections of disease in people with a superficial tumor of the type of cytostatic cancer are good. Clinical pathology in many cases is associated with the development of vectors. There is proof that cisplatin-based chemotherapies, especially when administered prior to surgery, may improve the prognosis of the course of the disease. This integrated chemotherapy is also the preferred treatment for patients diagnosed with transporters who are not interested in their surgery. To prevent malignant bladder cancer, it is recommended to follow the following. Quit smoking. Periodic examinations of the genitourinary system, especially when feeling any of the above symptoms. Avoid permanent exposure to chemicals that cause cancer.